button now so that we can make this Zoom webinar available to you at our website at pbisca.org. It'll be listed on the events page. It'll also be posted under our videos. So if you have to leave early or you have friends who couldn't make it today, they'll be able to get the webinar via video. Give us about a week. I'm hoping to post it sooner, but it might take as long as a week. So today's objectives, or rather considerations for today. Families have complex needs. Youth and families and children have complex needs. That has increased dramatically with COVID-19 pandemic. Many of you have experienced it personally in your own homes, but through your schools or communities. The needs for families have increased rather dramatically. So I want you just to think about, as we move through this crisis and return into school, what's that going to look like? Now more than ever, I believe we need strategies to support learning, concrete systems of support as we go through this crisis, and that I'm really going to focus on returning to school. We must also create a supportive learning systems for distance learning, but as of late, I've been thinking about distance learning. It's almost May, and we're going to be in the summer mode and then back to school before we know it. So for me and my team, we're supporting distance learning, but we're really starting to think about what's life going to be like as we return to school. And then again, no matter what your role in education is, you matter to every single student. So I have seen some valiant efforts from all of our educators, support staff, transportation people, front desk, everybody in supporting students in a different way. So you really matter. And I thank you so much for everything that you do to support kids and families. So we're going to look at today building effective systems for mental health supports. And again, I have to admit, I tweaked the presentation a little because I've really been thinking a lot about how are we going to return back when school comes in session. So right now, we really need to support our children with distance learning, setting up home strategies for behavior, systems for teaching and utilizing distance learning, but what's it going to look like when we return back to school? Quick acknowledgements before we really get going into the content. Thank you to the California PBIS Coalition, to Stephanie at Santa Clara County Office of Education for coming up with this idea to have a daily webinar series from the PBIS Coalition, the National Technical Assistance Center. The PBIS Coalition is funded in part through the National TA Center, but through the Department of Education. And then all of you, I thank you again for your time today. So 2 things to think about as we start. Take care of yourself. We cannot take care of our kids and families unless we're doing our own self-care. I'm reminded all day long from my staff, Michael, are you getting out? Are you going for walks? Are you getting sunshine in the middle of all your Zoom meetings? But please take care of yourselves, because we do have a rough road ahead. Not just in our communities, but the next bit of content that I'm going to go over is really hard, I think, for a lot of people to hear. So as we talk about mental health, what's happening to children and families, the rate of child abuse, make sure you take care of yourself during this webinar. Liz, does everything look okay to move forward?
Yes, it's all good.
Okay. So as I said, children and families have very complex needs. Truancy, being present or not present on distance learning, difficulty focusing while we're trying to support them through this crisis, avoidance behavior problems, difficulty reading, academic issues. Families are also struggling, adults and children, with depression, withdrawal, and other symptoms of mental illness. We know that about 1 in 5 children ages 13 to 18 has a serious mental illness. So that's about 20%. So if you're looking at your community of students that you support, it's a significant number. And I dare say that that number is increasing with the current economic situation and other stressors placed on families. We also know that about 1 in 5 adults in America experience mental illness. So mental illness, I think, is a lot more common than many of us realize, but that 48 million adults across the US experience mental illness in a given year. And we know that that's increasing dramatically while we're under the stress of the COVID-19 pandemic, job losses, unsure about where I'm going to live. Am I going to be able to feed my kids? So there's a lot of stress facing our families right now. Things you might see, sadness, students down, confused thinking, inability to concentrate, whether it's through distance learning or in person, excessive fears, worries, feelings of guilt by students as well as their families. I've talked to people in my own community who've lost jobs, and they're feeling of guilt because they are not sure how they're going to take care of their kids. Extreme mood changes. We also see significant exhaustion, low energy, as our helping professions are trying to support people who've been impacted by the pandemic, but as well as just the stress that this pandemic has caused is causing difficulty for people around stress, daily negotiating daily problems, trouble understanding or relating to situations. I'm going to give you a chance now to interact a little. We covered a lot of the logistics, but I'd like you in the chat box to tell me what you're feeling, what you've noticed since school's been out. I'll give you about a minute, a little less than a minute, to type in the chat box what you've seen from students that you've interacted with, colleagues, people in your community, adults that are supporting students and families. I'm seeing stress, crying, restlessness, lack of direction, overwhelmed, basic needs, hunger. How am I going to get food? School distributions only happen during the week. Melissa wrote, we need self-care. And yes, definitely. Another reminder, please take care of yourselves. Feelings of isolation, not just, we had feelings of isolation in rural communities were very pronounced before the crisis. I can't imagine what they are now. Difficult to care for siblings. So we know that there's a significant impact facing our kids and families. Now I'm going to talk a little bit about adverse childhood experience. Thank you all for putting your comments in the chat box. We are going to monitor the chat, and we're going to use this information later to also help us support how the coalition supports you as we come back to school as well. Oh, and I read the last one I was going to read in the chat, and thank you so much for the person who wrote, this is bringing us all closer together. I think we need to be optimistic, and I do believe it is bringing my team closer together, us as an agency, our statewide organization, and more. So adverse childhood experience, or ACEs, many of you are familiar with the ACEs. This was a study by the Center for Disease Control and Kaiser Permanente Hospital. Dr. Folletti and Dr. Anata looked at 17,000 patients for Kaiser between the years of 95 and 97. The original study wanted to focus, or their hypothesis was that we see students adults that have faced significant health issues. And their study focused on issues of obesity. And their hypothesis was that they felt that how we're treated, or the trauma that impacts us as a child affects us as adults. So they wanted to find that out by looking at 10 childhood traumas under the areas of abuse, neglect, and household dysfunction. So physical abuse, emotional abuse, things like physical neglect, emotional neglect, mental illness, incarceration, divorce, domestic violence, struggles like that. And what we've seen in our community, and I'm sure you've seen in yours, is dramatic increases in all three categories of abuse, neglect, and household dysfunction. In just the last 4 weeks, in our county alone, we've seen a significant increase in the number of children who've been detained because of child abuse. And it takes a lot for child welfare services to detain a child from a home. So I'm very concerned that while we go through this pandemic, the physical symptoms of the virus are significant, but the long-term impact on our children and families is going to be the trauma and mental health issues that last much longer, I think, than the pandemic. So looking at the categories of adverse experience, separated out between men, women, and total category under emotional abuse, we see increases or significant amount of abuse, sexual abuse, almost 25% for these individuals who were studied in the original adverse childhood study. So that's 17,000 patients in San Diego, California, experiencing sexual abuse. Physical abuse among men, I just highlighted the ones that stuck out for me, 29, 30%. And these, when this study was conducted in 1997, we're talking about people who were typically middle class, insured, probably Caucasian, middle to upper class, who had insurance. So these are pretty high numbers, and I wonder what they look like now after going through the crisis that we're currently going through. Under household dysfunction, we've seen in Placer dramatic increases in domestic violence and other household dysfunction. We've seen substance abuse increase, and I've highlighted a few of these that stick out for me as well. 30% for women, 9,000 women reported about 30% substance abuse in their home. So the things that happen to us as we're children impact us as we become adults. For the whole cohort in the original study, they found that for 4 or more adverse experiences, 12% of the total group had 4 or more, causing some pretty significant issues around mental health and other health outcomes. So we can see here on this slide that the impact for adversity led to a lack of physical activity, smoking, alcoholism, drug use, physical and mental health issues like obesity, depression, suicidality, etc. Now we have the impact of COVID-19. We are in education positioned to help support kids and families as they come back to school by partnering with our communities to mitigate some of this impact. As I said earlier, I believe that the impact of the virus is a terrible, terrible thing, but I want people to be very conscious as we return to school what the impact is going to be on our education environment, not just the loss of learning. So what about rural communities? So most of you today are from California, so I put up some totals. You may or may not live in some of these counties, but this is a snapshot from kidsdata.org on adverse experiences in California. You can see here, this is parent reported only. So 2 or more adverse experiences for rural communities versus urban communities. And just look at the Alameda and Fresno. Fresno County is significantly higher. They have a large portion of the county that's rural. Kern County, Merced County. So typically in California, we see increased incidence of adverse experience in our rural communities. Concerns regarding COVID is the increased social isolation, things that we saw in the chat box just a few minutes ago, a lack of resources in our rural community, a lack of access to health in our rural communities, all are impacting our kids and families. So the last slide I'm going to show is a snapshot from Monterey County, and I apologize if you're from Monterey County. This data is very consistent across the state. So we know that about 115,000 individuals are between the ages of 0 to 18 years old in Monterey County. 4,763 of them experienced allegations of child abuse. We know that of those allegations, 2,085 were between the ages, so school age, between the ages of 6 and 18. And then there were only 205 substantiations. So think about those two bottom numbers, the difference between reports of child abuse or neglect and the number of children who entered into the system. This is a significant difference. Our fear is that as we move past this crisis and move towards back to school, we're going to see these numbers increase. I'm going to move on. Regarding the impact of trauma on our kids and families, I'm going to give you one more chance to interact. What we typically see is physical symptoms, fear, depression, sleepiness, a tendency to be isolated, difficulty trusting others, acting out. And so in our chat box, if you could go ahead and write down what you've seen as you've been out of school, what you've experienced regarding the impact of trauma on our kids and families. Domestic violence increases, anxiety, diminished interest, yes, mood swings, neglect, lethargy, increase in one of you wrote, an increase in being trapped in a home with an abuser. Certainly that's a problem, and now we don't have eyes from the education community on families. Apathy, regression in health strategies, yes, definitely. Stress, fear of the unknown. So as these get posted, I want you to also think about, this is not just our kids, this is our community, our peers, our families are experiencing significant amounts of trauma and stress. So as we move on to coming back to school, we'll take a few more. Homesick, helplessness. Okay, thank you all so much for joining me in the chat box. I'm going to go ahead and kind of get to the next steps. So as we return back to school after COVID-19, and there will be an after, life may be a little bit different. There might be still social distancing and other precautions we take. But as an education community, I think we can do 3 significant strategies. I'm going to touch on them today. Again, we have like 40 minutes left, so I'm not going to teach you how to do these the day you get back. What I want you to do is investigate these strategies further. So the first is we need to increase our systems. Increase in systems increases protective factors. So I gave you a lot of data about what's happening to kids around depression, mental illness, trauma. It's not a life sentence. So the impact of COVID-19 is not a life sentence. What we can do as an education community is increase the protective factors for children. But I think we need systems. We don't need something that looks like the roadmap on the right. series of disconnected roads, and basically good luck getting to where we're going. So as we think about, as educators, returning to school, let's think about what systems can we put in place to support kids and families. Something you are acutely familiar with. I started using these materials prior to COVID-19 because I think hand washing is a good illustration of how to increase protective factors. So we know that hand washing is a really good idea. It's something that we do in hospitals, and hospital staff routinely wash their hands, and there's great adherence to this. But we do know from studies, and in your in the materials for today, you can get to this actual study, that hand washing decreases nearly 10% in a 12-hour shift. Some of that could be fatigue, some of that could be busyness, certainly now, but we know through this study that because during a 12-hour shift, hand washing decreases, that we need to think about installing systems. So we need to increase systems to increase the protective factors. So in this slide on my right, we wash our hands, we put soap, we rub it together, rinse, dry. That should be the solution. But I'm not sure that that's enough of a system to really be sure that we got all the viruses and germs. So this is an illustration of a comprehensive system for hand washing. We're explicitly saying palm to palm, rub our palms together, make sure we get our fingernails, wash in between the fingers, wash in that web area by your thumb, wash in between your fingers the web area, rinse and dry. So those of you who've been implementing PBIS know, the more explicit our system, the greater possibility to increase protective factors, decrease the behavior we don't want to see, and improve outcomes for our students and for our staff. So 3 strategies that we're going to look at. The first is positive behavior intervention and supports. And I know many of you use PBIS, but for PBIS, we really want to create equitable, effective systems for all students that are predictable, consistent, positive, safe, and equitable. And you know this from your experience and with PBIS. If you're new and maybe you're hearing it for the first time, I'm glad I can give you this information about building a framework for supporting students. But we also know that these are the consistent features that we want to install to create a trauma-responsive environment for kids and families. So if you go to the National Child Traumatic Stress Network from UCLA and Duke University, you'll see that their information on how do we create a trauma-responsive environment all include these factors. We want to create a predictable environment by maintaining usual routines, creating a sense of normalcy for our students, particularly as they return from this crisis. How do we communicate the messages that we want our students to hear or staff to hear? Next, we know that we want to have a positive, consistent environment. We want to set clear, firm limits for inappropriate behavior and develop a logical rather than a punitive set of consequences. We want to prepare students, excuse me, and have them know if they're doing something out of the ordinary. We want schools to support all children to feel safe, physically, socially, and emotionally. And we know that PBIS brings this to our children and families. We want schools to support students in a holistic way, both self-regulation, academic competency, physical and emotional well-being. So we know that PBIS creates a framework for supporting our children, especially as they return to school. So I borrowed this illustration from Don Kincaid at the University of South Florida, and I really like for those to share it with you. For those of you who haven't seen PBIS before, and those of you who have, think of PBIS as a framework or as a bicycle. We know that The frame of the bike is PBIS, and it almost is a triangle, actually. I'm noticing that now. But the framework is PBIS. We know that we have a school team, and they help support the school-wide group of educators as they move forward. They can help power the system. The steering wheel is the coaching, the direction of the team. Think of the school principal as the gearbox that's power in it, that's able to regulate whether the school team goes slower or faster. The drivetrain, the pedals is our implementation. And the tires is the evidence-based practice. Do we use knobby tires for rough roads or slick tires for street riding? And then data is our math that helps guide us. So it's a nice illustration to think about PBIS as really the framework, and the parts of the framework help move us forward. So PBIS being a framework for enhancing the adoption, implementation of evidence-based strategies for important academic, behavioral, and social emotional outcomes. Lots of you are familiar with the picture of PBIS. What do we do for all students? Setting up core instruction, preventative factors, having common rules, expectations. The students need a little bit more. We have targeted interventions, and then more intensive interventions for students who need the most support and help, and their families. So that's your typical behavioral continuum. And what I want you to do is really think about, as we know kids are coming back to school and their families, what types of supports are they going to need around mental health? So here's a system of support when we start thinking about student wellness. We want universal strategies that are preventative and supportive. We want small group tier 2 strategies for mental wellness that provide greater interventions. And then we want tier 3 strategies, whether we're doing those strategies as a school district or school provider, or we're helping getting support from the community. So here's an illustration of what that might look like. So as you think about returning to school and getting together with your teams, what's our multi-tiered strategy? So we know PBIS is providing the framework, right? That we're setting up strong behavioral conditions for children to succeed. But what about their mental health and wellness? Start thinking about, how do we structure the system of supports? What do we do for all students around mental wellness? At the bottom, I'm not endorsing any of these strategies. They're just some that happen in our community. But you can look at positive action promoting alternative thinking, a universal strategy for mental health support. For tier 2, you might have a system like white bison for substance abuse treatment, or adolescents coping with depression. Those are small group tier 2 wellness interventions for children at school. Tier 3, your school might consider something like functional family therapy or wraparound, parent-child interactive therapy, incredible years. Most importantly, though, I want you to think about the systems that we have, not just for behavior, but how do we look at our mental health supports at our school site, and also the mental health supports we have across the sidewalk in the community, and map those supports. It's going to be important to be strategic as we return to school. Here's another look at it. So if we're looking through the lens of suicide prevention, how do we organize our system of supports for children as they return to school, and adolescents and their families around suicide prevention? And I just put some examples here. Some tier 1 strategies might be youth group called NAMI on campus. You might train QPR as a gatekeeper type of training. You might utilize Cognito, which is an opportunity to train every educator on campus to recognize signs and symptoms of mental distress or safe talk. Tier 2, excuse me. In tier 2, we might look at more targeted types of support like mental health, first aid, or signs of suicide. And then for tier 3, really looking at applied suicide intervention skills training or coping and support training. These are strategies that will help support students with the most highest needs around suicide prevention. So for our state, as we return to school, think about how do we structure our suicide prevention strategies. Not every teacher in a campus needs to be trained in applied suicide intervention skills or assist, but every teacher should be trained in a universal approach. So here's a list of resources for you. As you think about what are the systems or what are the supports, interventions, programs that we can put in place, I've listed some evidence-based clearinghouses, and in the materials for today, you could click on any of these and be brought to these websites. Most of these websites organize the strategy by tier. So you can look up, like I said, cope and support, and you'll see that it's what tier or what, whether it's tier 1, tier 2, or tier 3. My favorite, I pointed out at the bottom, is the Colorado Blueprints. And so just take some time as you're preparing for school, going back to school and looking at programs to look at these websites. Also, these websites will indicate whether it's an evidence-based practice or a promising practice. What I also want you to do is I want you to look at how do we organize the supports we have for children and families. 2 tools that I'm offering you through the University of North Carolina. One is an initiative inventory. As we prepare to go back to school, write out what mental health and supportive initiatives do we have available by the school and available by the community. And this is an active link in the materials box for today. So if you click on it, it will take you right to this tool that you can download and start to think about how can we capture the things that we need, that we're currently doing for students. On the right is another tool called the Hexagon tool. And this is a way to look at, is this program or this practice that we're using something that will fit our environment at the school? So what's the level of evidence? Is it a usable practice? Do we have the support systems we need necessary to be successful with it? What's our need? Do we need this? What does the data say? How does it fit with our current environment? And then do we have the capacity to actually implement this practice? So please visit these websites. I don't want people to start selecting programs that they think might work or that they saw at a conference or were marketed to them without really using the Hexagon tool to really evaluate whether it's a practice that will work for your school site. Let's skip through that. There's a larger picture of the Hexagon tool. And mostly the reason I added a puppy dog here is because I don't want people just chasing after the shiny object or the puppy. Please be methodical in your selection of practices and interventions as we go back to return and support our students. So next, I want to help you understand just a little bit about the law. Things have changed dramatically over the last 4 or 5 years, but we know that in California, there's been increased requirements for schools around mental health and wellness. Those include having to have a board policy, not just for 7th through 12th grade, but for K through 12th grade now. Every school will need a board policy and a way to articulate what we are doing for students. So having a multi-tiered system in place is a way to be able to better articulate that. We know that we need identification cards that show not just the suicide prevention number on the back, but domestic violence hotline as well. Schools shall notify families of mental health supports is AB 2022. So twice a year, we need to help people understand what we're doing to support our families. And then lastly is AB 2083 for foster youth, asking us to integrate with behavioral health. I'm going to pause for a moment. I see we have some questions. And I'll move over to the chat box. So will this webinar be available after? Yes, you'll be able to get a recording online. Liz, did you happen to capture the other questions?
Yes, there was a question in regards to how do these supports compare with general ed versus special ed kids? How can we use these supports you are teaching to help our kids with special needs adapt to their new environment?
I think what we need to first look at is the whole school environment. So these supports, dependent on the needs of the student, we want to set up a system of support for every student. So sometimes I visit schools and I'll see special ed students kind of separated or different programs for special education. The supports I'm talking about are more universal or targeted for the general ed population, and then being adapted for students with IEPs depending on the significance or severity of their disability. Were there other questions, Liz?
No, I think we've answered the rest of them.
Okay, and I see people will be looking for the webinar afterwards. It'll be posted. And so back to integration. So we know that the law, California state law, effective this past January, we're supposed to be able to articulate that in our county, we've set up an integrated collaboration between child welfare services, behavioral health, probation, and yes, education. So what does that collaborative look like in your county? When I talk about this law prior to COVID and have gone around the state speaking about it, very few educators are aware of this requirement for integration. So as we move back to school and back to how we're going to prepare to the aftermath of COVID, I want education communities to think about not being isolated, but how can we collaborate more effectively with our partners in child welfare, probation, and behavioral health. We shouldn't need a law to tell us to do that. And now, even in the chat, I've seen comments from people about being more collaborative, more joined with our community. So I owe a lot of this next bit of information to Susan Barrett, but what does it mean to integrate? We need to change our routines and procedures. We need to look at who's available to participate in our team meetings. So what does the ecology look like? And I'll show you an illustration in a minute. But who do we need on our team now as we support children and families? Do we need a social worker? Do we need a mental health professional? Do we need somebody from the homeless shelter 1 block away from the school? How do we organize our team and what procedures do we have in place? Think about change in how interventions are selected. And I showed you the initiative inventory, but really guiding the selection of interventions by data, not just individual clinician choice or a principal deciding, well, we need this intervention, I saw it somewhere, but really using a tool like the hexagon tool to select an intervention. We need to change in our language, change the language we use, identify specific interventions rather than generic, and look at real specific supports for children and families. And we need to change in the roles or routines or function of staff. Clinicians coordinating or overseeing some of the interventions and non-clinicians delivering it. I think an example you could use paraprofessionals to deliver many universal interventions for students. Recently, when I was presenting with a colleague, she said, it's everybody's responsibility. Someone said, whose responsibility is it for mental health? And she said, it's everyone's. And it just warmed my soul because it is all of our responsibility. We're not trying to make a clinician out of individuals, but we are trying to be able to establish a continuum of supports for children. It's about blending academic, behavioral, and social emotional interventions into an integrated continuum for students. So this illustration is not won't be unique in every, will be unique in every school site. So I want folks to look at, as we return, what does an integrated team look like? So as you come back to school, typically we've made a lot of decisions in silos. But what would your integrated team look like? Do you have family members on your team? Do you have mental health professionals, academic staff, teachers? Do you have school psychologists? Do you have a community-based agency as part of your school site or your integrated team? So we're moving from that traditional PBIS team to a team that is more robust, has more expertise to support our children and families while we support the systems that we put in place using database decision making and installing significant practices that are responding to the needs that we have or that we're seeing in our students. We want a team that meets regularly. We want to use database decision making, a referral or nomination process, a comprehensive way of saying that Michael needs additional support, not just that I feel like Mike might need something, but how do we have a referral process that's significant in place? We want respect for each of the members of the team. Collaboration is hard. And when we don't understand another person's discipline, sometimes we don't understand their perspective. So we need to have respect for members of the team, utilizing the previous point that I was making around a framework, a multi-tiered system of support. And then we want to define the social structure and expectations. And that's defining the structured social expectations for the team. So what are our social expectations? What 3 to 5 social expectations do we have as a team to deliver to students? We want to use a systematic way of decision making. So if you haven't been implementing something like team-initiated problem solving, I want you to look at how do we use a systems approach for problem solving as we go back to school. And please, maybe we'll do an additional webinar on tips, but please look at this model in the materials. What's the problem or when is it occurring? So we want to identify a problem with specific precision. We want to identify goals for change, solutions, implement that solution, monitor, look at evaluation decisions, and then it's a circular process, right? So next, we want to come back to school with really clear expectations. And I like this illustration because we show what our expectations might look at the elementary level, the middle school level, and the high school level. So as our students return, taking the opportunity to be very explicit about creating that trauma-informed environment by having clear and consistent expectations. And then I owe this slide to Susan Barrett, but to start thinking about how we teach social expectations in a different way. Many of you are familiar with the teaching matrix, where we look at what is the social expectation we want to see. So on the left-hand side, you can see the expectation is safety. We want a student to be safe. Where is that occurring? In the hallway, so the natural context where we're going to teach the expectation. And then what's the specific behavior we want to see from a student? So in this case, it's use normal voice volume and walk to the right. So in our PBIS work, this is pretty traditional. What's the expectation? Where is the behavior occurring that we want to teach? And then what specifically is that behavior? But now look to the middle, to the highlighted sections. Let's think of social emotional learning or mental health or mindfulness. So being responsible at snack time means use my breathing technique and listen to my internal signals. So really start helping students shift from a mindset of here's our social expectations, but also how can we teach students mindfulness or under safety, have a plan to choose a quiet or social break area. Invite a friend to join me. Or under respectful, invite those sitting to join. And then the last strategy I'm going to give you today, we're almost out of time. This was a lot of information in an hour. Barbara Kelly and Christy talked about welcoming students or greetings at the door. So positive greetings at the door was a recent study conducted by Clayton Cook, and we all know that greeting students as they come into class is a good idea. Well, Dr. Cook took it a step further and did a bit of research around what does it look like? How can we show evidence of those outcomes? So as we think about returning to school, can we set up a system where we positively greet students at the door, but utilizing our PBIS framework and specific expectations? So they studied PBIS and being very specific, creating very specific greetings at the door. And what they found was that we have about 10 more minutes. Liz is giving me the prompt. And we're almost there too. So positive greetings at the door. On the left-hand side, you can see pre-intervention and then the dotted line and post-intervention along the timeline. The solid is positive greetings at the door group, and the hashtag or dotted line is the control group. So you can see a significant increase if we utilize positive greetings at the door for students behaviorally. Academically on the left side, and then on the right side is behaviorally. You can see a decrease in the types of behavior we see in students. So real quick, the steps, we want to be specific. So this isn't the dances, the high fives that we see. Those are all important in engaging with students. But to utilize the strategy of positive greetings at the door, we really want to follow these 4 simple steps. We want to stand at or around the door, about the simplest thing you can do as we coach staff and return back to school. We want to positively interact as students come in, but the trick is to be specific. So we might say something like, I see you were being respectful, Liz, when you entered the classroom, or I see you were being kind to your neighbor as you lined up. So being specific and using your current school-wide expectations and integrating those into the behavior, into the greeting. We're going to teach it with specificity, and therefore we're going to reinstall the learning for students, but we're also going to reinforce for students who may not understand what the expectations are. 3, we want to utilize pre-corrective statements to individual students or the entire class. Michael, thank you for being respectful as you enter the class today. And that would be for a student who maybe isn't always respectful, or thank you for being safe as you enter the class. We're using a pre-corrective statement to remind the student. And then the last part of the strategy is to remind students to look at the activity or give them a prompt for consistency. What's the expectation when I sit down? Is to take out my history book and focus on chapter 4 or whatever the lesson is for that day. Really simple. We can see the significant outcomes from those strategies and evidence-based when connected with PBIS. We cannot do a practice because we're remote, but those are there for you as you return back to your groups and social distancing is lessened and we get back to school. I left those practice scenarios in there for you as you return. So in summary, social emotional needs for students are far more common than we previously thought, especially now with COVID-19 and returning back to school from the pandemic. Educators can make a real difference, each one of you as we return, staying connected with our students while we're away, but as we return as well, and getting them prepared to integrate back into school. And no matter what your role is, you're important to the school environment, and we've seen that no more now than ever. Remember, on the left-hand side, I added this quote: "You're not required to set yourself on fire to keep others warm. So take care of yourselves, please, as we go through this crisis and return back to the school year next year."
Mike, there's a couple of questions in the chat box.
Okay,
A bit of a discussion in regards to greeting at the door with the COVID thing, different suggestions instead of a high five.
So let's see, grading students in the morning, engage their mood for all day. Definitely, absolutely. Elbow bumps, for sure. Please, let's avoid shaking hands. Ear high fives, definite. Do the hokey pokey. I'm not sure how to do that, but that's a good strategy. It's a dance. If you know me, you know I don't dance. Some thank yous, elbow bumps, foot bumps. So we're using a way, most of those ideas are the connection. Secret handshake, again, we want to make sure social distancing restrictions are lessened. But the goal is to use something to engage with students, but please be specific when you engage with students. So I see you're being respectful by the way you came in. High five or ear high five, foot bump. Please reinforce the expectations. We see the significant outcomes for that. And then what I'd like you to do right now is take out your telephone, take a picture of the QR code that I provided you, and that's going to take you directly to a survey for today. We appreciate your feedback. We're using that survey to help support our future trainings. I know it was just an hour and a ton of information. I could have did 3 days on each of these topics easily, but these webinars are intended to help prompt you and help you think about what the next steps will be. So I'll give you a minute to get a snapshot of the QR code or the URL. I'm very impressed with myself, honestly, because I was able to make a QR code. While you're taking the survey, I want to remind you or let you know, if you haven't heard, the California PBIS Coalition, the recognition system is changing slightly this year. We have modified our recognition process because you can't be at school to do the recognition steps. We decided to create a community cares acknowledgement. So please visit the website. We're asking people to submit artifacts for how you've helped in your community. And then we're going to highlight those artifacts at our conference. As of right now, we plan to have our conference on September 21st and 22nd. It's going to look a little bit different. Clearly, we're going to have more social distancing, so it won't be quite as crowded as last year. But we want the conference to be there to share the value of our experiences, but also to share strategies on how we're bringing students back to school after this crisis. And call for papers is still open, I think, for about 3 more weeks, so get your papers in. And lastly, please don't forget, we have a webinar day for the next 15 days. Join us on another webinar, and I wish I could have interacted more visually with all of you, but thank you so much for joining me, taking some time out on a sunny afternoon, and I look forward to meeting you all in person someday. Thank you. Bye. Someone asked for the QR code. There you go. Thank you. Thank you all. I'll leave the QR code up as we close the webinar. Thank you.
Mike, there's a request to put the tiny URL for the evaluation in the chat box.
It is up there now.
Okay, perfect. Thank you.
So if they just use the QR code or this tiny URL, oh, I'm sorry, in the chat box. Yes, I can do that. Thank you, Liz. Okay. Oh, there it is. There you go. Now it's in the chat box. Materials, I saw a question about materials. Those are all posted. The materials themselves have hot links, so just click on the link and it'll take you right to the material or to the item. Looking for the URL again. I think that was Jamie. Oh, there's a question about a certificate for participating from Michelle. Please contact me individually and we'll get you a certificate. The links should work, Lisa, if you right click on them. If they don't, I'm going to put up my email address again and you can email me directly. There you go. Post-webinar confirmation, I'll work with Liz on how to do that. And we'll make sure all the links work. It should be a right click on the PDF and then it'll take you to the link. It'll say, it'll give you a choice to open hyperlink. And I will check immediately following this webinar. Okay, thank you, Lisa. I will check right after I get off the webinar. And so just sort of stick around there for a little bit and I'll make sure that they're working. Also, Lisa, why don't you email me directly too? There's my email address on the screen. Okay. Excellent. Okay, well, thank you, everybody. I'm going to close the webinar for today. I appreciate your time. I know, again, it was fast, but I know how hard it is right now, and I'm just so grateful for your time. Thank you so much. Bye, everyone. Give it just another second, and we'll close it out. Bye, everyone.